Cancer treatment can mean months, even years of radiation and chemotherapy, but research may change the way physicians deal with the disease in the future. KITV4's Pamela Young continues our series in preparation for the Komen Race for the Cure, with a revolutionary new approach to the most dreaded part of post-surgery treatment.
You have to do what you gotta do.
And what many cancer patients gotta do is chemotherapy, the intravenous medicine that kills and controls cancer cells. But in the process, it also kills good cells, so patients often have devastating side effects: fatigue, nausea, dizziness, loss of hair.
Tiredness, my fingers are numb, my toes are numb. In fact, my toenail fell off recently.
All that could be changing.
I didn't want to take chemo for the second time. And I told my doctor that no chemo. So she looked into other alternatives, and then she decided that I would have been a good candidate to take the clinical medication.
Kaiser Permanente is now doing clinical trials on an oral medication that targets only the cancer cells and leaves the good cells alone.
It's using a medication that many women know as aromacin, and in the medical lease we call it exemestane, and it uses a drug. It's called an mTOR inhibitor.
And for Estelle, it's been a prayer answered.
Her tumor has shrunk to the degree you can't see it in any of her imaging scans, and so she's had what we call a really nice response. Sometimes we call it a complete response, but most importantly, she went from being debilitated to completely functional.
The pill is not without side effects of its own, headaches and mouth blisters, but Estelle is willing to tolerate the discomfort.
If you want to get better, you know, you want to live a little bit longer, you know, I would definitely have them to try it. You know, you got nothing to lose, you know. It's all about you, and you're the one that's going to benefit by it.
Estelle and other patients in the study still face many uncertainties, but they're willing to take a risk now so future cancer patients will have more options.
It's another way that we can actually target this cancer cell. I mean, the long-term hope is that we can actually cure cancer.
At Kaiser Moanalua, Pamela Young, KITV4 News.